Prostate cancer is a cancer that develops due to abnormal and uncontrolled growth of cells in the prostate, a small walnut-shaped gland located under the bladder and in front of the rectum. This small gland plays an important role in keeping the sperm healthy for pregnancy by secreting the fluid that mixes with semen. The most obvious symptoms of prostate cancer, which is a common and serious type of cancer, include frequent urination, especially at night, difficulty urinating, burning sensation and pain. Early diagnosis is of vital importance in prostate cancer, which can be treated. What is prostate cancer? Prostate cancer is a cancer that occurs as a result of uncontrolled and abnormal growth of cells in the walnut-sized prostate gland, which produces the seminal fluid that nourishes sperm in men. Prostate cancer, which is a common type of cancer seen only in men, commonly causes symptoms such as frequent urination, decreased urine flow, difficulty urinating, pain, and a burning sensation. Prostate cancer, whose underlying and most common cause is old age, is usually seen in men over 50 years of age. In addition to the age factor, conditions such as genetic predisposition and obesity can also be considered as causes of prostate cancer. The most important criterion in prostate cancer treatment is early diagnosis. What causes prostate cancer? The cause of prostate cancer is not fully known. Prostate cancer occurs when some prostate cells grow out of control due to genetic defects at the cellular level and replace normal cells. It can then spread to surrounding tissues and at advanced levels to distant organs. In addition, the underlying causes of prostate cancer are generally genetic predisposition, age, race, and nutrition. Common causes of prostate cancer are genetic predisposition. 9% of prostate cancers are hereditary, and 15% of those with prostate cancer inherit the disease from their first-degree male relatives. Mutation in the BRCA2 gene, which is known to be linked to breast and ovarian cancers in women, has also been observed to increase the risk of prostate cancer in men. Non-genetic environmental factors. Environmental factors are more effective than genetic factors in prostate cancer. For example, while the risk of prostate cancer for a Chinese person living in China is much lower than that of an American, when the same Chinese individual lives in America for a long time, he begins to have a similar risk of prostate cancer to an American. Age factor. The risk of prostate cancer increases with age. Prostate cancer, which is rare in men under the age of 50, is common in men over the age of 50. It is known that 1 in 6 men will be diagnosed with prostate cancer during their lifetime. Race factor. Race factor is also important in prostate cancer. Prostate cancer is most common in black men, followed by white men. It is also rarely seen in men living in Asia, Pacific Islands. Nutrition and obesity. The direct effect of nutrition on prostate cancer has not been proven, although previous research has shown that selenium and vitamin E may reduce the risk of prostate cancer. Clearer results from later studies have shown that neither provides benefits. However, since healthy eating and obesity reduce the risk of cancer, consuming unhealthy foods can directly increase the risk of prostate cancer. What are the symptoms of prostate cancer? Generally, there may be no symptoms in early-stage prostate cancer. Symptoms mostly occur in advanced prostate cancer. Prostate cancer symptoms that occur with urination problems are frequent urination, pain and burning sensation when urinating, slow or weak urine flow, blood in the urine, hematuria, urinary incontinence, pain when ejaculating or blood in semen, pain in the hips, back, chest or bones, pain in the lower pelvic area, loss of appetite, weight loss, tiredness, nausea and vomiting, frequent urination, especially at night, since the prostate gland is located just below the bladder and surrounds the urethra. Cancerous cell formation in the prostate gland puts pressure on the bladder and urinary tract, causing the person to urinate frequently, especially at night. Having difficulty urinating again, abnormal growth of cells in the prostate gland puts pressure on the urinary tract and causes the person to have difficulty urinating. decreased urine flow. As a result of the prostate pressing on the urethra, there is difficulty in urinating and a decrease in urine flow occurs. Pain and burning sensation when urinating. In advanced stage prostate cancer, as the cancer may spread from the periphery of the prostate to its center, it may block the passage of urine through the prostate and cause a burning sensation along with pain during urination. Blood in the urine, hematuria. The enlarged prostate puts pressure on the urethra, causing irritation of the bladder and causing blood in the urine called hematuria. Urinary incontinence. In prostate cancer, the symptom of urinary incontinence may occur because the enlarged prostate gland may block the urinary tract. Pain during ejaculation. Pain during erection, one of the symptoms of prostate cancer, is caused by the blockage caused by the growth of cancerous cells in the prostate. Because the resulting tumors put pressure on nearby organs and tissues, causing pain. Pain in the lower pelvic area, uncontrolled growths in the prostate gland can cause pain in the lower abdomen when it puts pressure on the bladder or urethra. What are the stages of prostate cancer? Prostate cancer is divided into stages according to its spread. The most important criteria in staging are whether the prostate tumor has spread to surrounding tissues, such as the bladder or rectum, and whether it affects the lymph nodes and bones. Gleason score and PSA level, which indicate the tumor grade, are also important to determine the stages of prostate cancer. The stages of prostate cancer divided into 4 are as follows. Stage 1. Prostate cancer means the cancer is still limited to the prostate and has not spread to other areas. Stage 1. Symptoms of prostate cancer are the need to urinate frequently, difficulty urinating, and pain and burning sensation while urinating. However, prostate cancer may not always show symptoms in Stage 1. Stage 2. The second stage of prostate cancer is the stage of prostate cancer in which cancer cells remain limited to the prostate gland, but the risk of spread is higher than the first stage. Stage 3. The third stage is the locally advanced stage of prostate cancer. Stage 4. In this stage of prostate cancer, the cancer has spread to the lymph nodes or other parts of the body. How is prostate cancer diagnosed? If there is a possibility of prostate cancer based on the patient's PSA blood test and/or rectal examination results, the suspicion must be confirmed by biopsy. Prostate cancer is diagnosed as a result of one or more biopsies performed on the prostate gland. Biopsy determines whether the patient has benign prostatic hyperplasia, cancer, or other existing medical problems. During the biopsy, a few small pieces of sample are taken from the prostate tissue by entering the rectum with the help of a needle. These tissue samples are examined under a microscope to detect any cancer cells. The following scans are performed to diagnose prostate cancer. PSA blood test. The PSA level in the blood of a patient diagnosed with prostate cancer is equal to the amount of cancer in his body. PSA, prostate-specific antigen, is a protein produced by the cells in the prostate, and the higher its amount in the blood, the more advanced the prostate cancer is. At the same time, the PSA level is extremely helpful in monitoring the success of the treatment given or in detecting recurrence after surgery. Anal finger examination. It is one of the most commonly used prostate cancer screening tests. The patient's prostate is touched with a finger, and abnormalities are examined according to its size and characteristics. Transrectal ultrasonography. During transrectal rectal ultrasonography, a small probe is inserted into the rectum. The probe emits high-frequency sound waves that produce echo and bounce back by hitting the prostate. Using these echoes, the computer creates the picture with a sonogram that can show abnormal areas. Research continues to show that transrectal ultrasonography reduces the vital risk of prostate cancer. Advanced PSA test. Studies are continuing to develop the PSA test for more specific results regarding pancreatic cancer. The clearer the PSA results, the less anxious the patient is, and the less other tests are needed. Insulin-like growth factor. Insulin-like growth factor, IGF, is an important growth and anti-apoptotic, preventing cell death factor for cancer cells in many types of cancer. Insulin-like growth factor binding protein 3, IGF-BP3, on the other hand, stimulates apoptosis, cell death, independent of IGF-1 and inhibits growth. Recent research indicates that increased rates of high IGF-I and low GFBP3 levels, or both, are associated with an increased risk of prostate cancer. How is prostate cancer treated? If prostate cancer is at an early stage, follow-up may be recommended instead of immediate treatment. Surgery is one of the most common and effective treatment methods for prostate cancer. Robotic, laparoscopic, and open surgical methods are available, and each surgical method should be preferred according to the patient. The aim of the surgical approach is to remove the entire prostate. In appropriate cases, the nerves around the prostate that help erection in the penis can be preserved. The surgery of choice for early-stage prostate cancer is laparoscopy. Again, early-stage prostate radiation therapy, radiotherapy, is an important treatment option in suitable patients. Laparoscopic surgery provides the patient with a comfortable operating process and has high success rates in terms of cancer control. After these surgeries, which are performed through 4-5 small holes, the patient experiences less pain and can return to daily activities in a short time. Since there is no surgical incision, these surgeries provide a high degree of patient satisfaction cosmetically. Major advances in the diagnosis and treatment of prostate cancer make this disease no longer a feared disease. Frequently asked questions about prostate cancer. What symptoms are seen in prostate cancer? In prostate cancer, urine flow is weak or intermittent. There is a need to urinate frequently, especially at night. The bladder cannot be emptied completely, or it feels like it. There is pain or burning during urination, as well as mild pain in the lower pelvic area. If the cancer has progressed, fatigue, nausea, and vomiting are also observed. Is prostate cancer dangerous? Early diagnosis of prostate cancer is very important. Especially stage 4 prostate cancer carries serious risks and has a high mortality rate. Does prostate cancer kill? Fatal cases of prostate cancer usually occur in advanced stages, and the death of the cancer means that it has spread to other organs. Where does prostate cancer spread first? Prostate cancer generally metastasizes to lymph nodes and bones. In addition, it also spreads to the colon and intestines. Can prostate cancer be cured? Prostate cancer is among the cancer types with high treatment success when detected at an early stage. Since it is a cancer that usually doesn't cause symptoms in its initial stages, every man must have an annual prostate examination and blood tests starting from the age of 40.